Hallelujah, hallelujah, siyabonga. Hallelujah, siyabonga.
Unfortunately, people are not really serious about their health until they know that they are dying. And don't overcook it, because when you overcook your food, at the same time you destroy most of the vitamins and stuff in it. And that's what we do when we teach the cooking classes.
Wow.
We're live. So it is a cool evening here in Painesville at the office of Giving Jesus Global, where the Sing Studios is located. And today we are privileged to have this interaction with Mrs. Lois Whea Grant, who is a medical missionary and the Chief Executive Officer of Restoring Health and Uplifting Souls for Heaven. And this is an institution founded some years ago, which she will speak about, to help underprivileged people and communities by providing medical healthcare services and humanitarian support to people. Auntie Lois, as I love to call you, welcome to this interaction.
Yes, thank you. Thank you very much.
So you'd like to tell us more about yourself and the work you do at RHUSH?
Okay, so my name is Lois Whea Grant, and I'm a nurse by profession, and I've worked in healthcare, specifically in the OR, for some years, until my husband and I decided that it would be good for me to stay home and look after my family. And so that's exactly what I did. But I became a medical missionary when, some years back, my late father, when he was alive, he had cancer. And when he was diagnosed, we knew, and I know because from working in a hospital, I know that, when it comes to cancer, there's really no cure for cancer. But then I also learned that cancer could be cured by, natural means. And so someone told me about medical missionary. At the time, I didn't really know much about them. And they told me that, they could help people, treat people with cancer naturally. So that was my first introduction. And so my dad, we sent to go and have treatment at this place, this lifestyle center, with some medical missionaries back in the States. And he was really successful with that. When I saw it and saw how it worked, that caught my attention.
Wow.
And it was from there that I started, inquiring about them and finding out how I could become a medical missionary.
And so, incredible story. We're sorry for the loss of your dad and that of your son. Oh, what does it mean to be a medical missionary?
Oh, it means a lot, because as a medical missionary, we see lives transform, because medical missionaries are not just people who takes care of people's health. We also help them spiritually. We bring the gospel to them. We teach them, and
we bring the gospel to them.
We bring the gospel to them. So Jesus Christ, as we know, was the first medical missionary. So because medical missionaries, like I said, they restore health, they help people with their health, with healing, and at the same time they bring the gospel. So he did the same exact thing. If you follow the story in the Bible, everywhere Jesus went, he healed people. Right. People would follow him everywhere. And, and at the same time, he preached to them. So that's basically what a missionary, medical missionary does.
You live in America, but come to Liberia every year. How often do you come here? And whenever you're in Liberia, what do you do with your institution?
Well, I do come once a year, so far. And so when we come, we do outreach in different communities where we do teaching. We teach people about lifestyle diseases, different lifestyle diseases because, me working in healthcare, I came to see firsthand what, drugs can really do to people. Drugs are good. They have their part, that they play. But at the same time, drugs, they have many side effects that can cause some worse conditions than what you're trying to treat with the drugs. And so the medical missionaries, they teach you, we teach people when we come here, we teach them how to eat and how to basically take care of their body. We use the 8 laws of health, and we basically just teach them how to take care of themselves and how to reverse these diseases.
So I like to eat my greens fried, meat boiled, and that's the imported chicken and the imported pig feet and everything.
We advise them not to. We advise them not to not to go that route.
Okay.
Because you become what you eat.
Right.
Okay? If you take good care of yourself, and that is the one thing that I learned as a medical missionary, especially when I was going through my training as a medical missionary. So, your body, the way God made our bodies, our body can heal itself. This body can heal itself if you give it the right, the right condition. So, for an example, for someone who's suffering from a cardiovascular disease, let's say high blood pressure, there are things that you can do to help yourself, as we know that it's caused by so many different things, from the way you eat, you don't exercise, and because of that, it can cause you, to suffer from the high blood pressure, which can later on lead to stroke or maybe even a heart attack and things like that. So we teach them, not to eat fried foods, not to eat, saturated fat. Those things are not good. And also we show them how to make their food and exercise, and we give them a protocol to follow so that they cannot, so that it can help them reverse their disease. Because like I said, the body can heal itself, but you have to give the body that condition. You have to treat it, with just basically what you do with yourself. What you put in your mouth is very, very important, and people don't understand that. I see a lot of things here, the way people eat here in Liberia, especially when it comes to the fat content. They like to fry everything, and the meat that the people have on the market is not the best. And the sad thing is that in Liberia, we have one of the best food in the world, for the simple fact that a lot of the stuff that we have are grown organically, If the people would just use what they have here naturally, if they would just use that and stop eating all this frozen meat that we have on the market. Someone was even cooking the other day, and they have this oil that they use for frying. They call it, they think it's vegetable oil.
Yes.
But it's not. It's
Wow.
actually made from palm oil, and palm oil is one of the worst oil you can eat. So you put palm oil in the refrigerator and you test it. You put some olive oil, and you will see that palm oil will get hard like rock.
Right.
As a matter of fact, I had some sesame seed oil in my house that I left here a few years ago. I came back and that oil was as clear as anything. It was liquid. You can't do that same thing with palm oil. You keep palm oil for a few years, even if you didn't put it in the refrigerator, it will still get hard. And it's not a good oil, and so the people using it for everything. They fry, they mayonnaise, for an example. Those things are not good. We need to stay away from the Western way of eating and go back to our natural way of eating, the things that we used to eating, like the edibles, potatoes, potato grains, and like you mentioned, don't fry your potato grains. You can steam it, you can saute it, and don't overcook it, because when you overcook your food, at the same time you destroy most of the vitamins and stuff in it. And that's what we do when we teach the cooking classes.
Wow. So as a medical missionary, I mean, it's really interesting to hear about what you are saying. Whenever you come to Liberia and get involved with communities across the country, how many people show up? Do you have a data or an idea, an estimate of the number of people who show up?
People are not really serious about their health until they know that they are dying. That's a fact.
Wow.
We come and we do these health cares, outreach, okay? We do health fairs. And before we even begin, we go into that community, taking flyers, telling the people about what's going to be happening. And sometimes we get a good turnout, and sometimes we don't. Like in the Habet area, we had about over 200 people showed up for that health fair. Okay. And we were able to find many people with high blood pressure, diabetes, most of them who didn't even know that they had the disease, and they're just walking around with a blood pressure of 200, they're systolic 200, diastolic 130.
Wow.
That's a place for stroke. And sometimes it scares me. And the thing is, it's not just older people, and that's what really caught my attention. A lot of young people coming down with these cardiovascular disease, and it's just basically from the food that they eat. That's why it's called a lifestyle disease. Not that many of them come, but we're encouraging people. We want people to get to know about this, and we test them. When you come, we test you for this trip that we took, this mission trip. We were focused on actually testing for diabetes and for high blood pressure.
Okay.
And during the time we were doing this, we even found people. There was one gentleman, I remember this was in Kakata, and this guy was actually having stroke symptoms while he was there. When we were checking him, we had to rush him to the hospital. So that's basically what we do. We want to just let the people know, and we want them to be aware about, how they can help themselves, because prevention is better than cure. And there are many things that you can do that will stop you from going to the hospital. I see people, like the other day I was at EWA hospital, and this lady died right in the keke because the hospital was full. They couldn't take any more patients. And the husband, based on what he explained, it seemed like two things. It could have been either from diabetes, or probably it was from a stroke. But they said she wasn't sick. She wasn't sick. She just started complaining she wasn't feeling well. So I wish that people would join us, people would partner with us, so that we can really do this, because it's not just only in Liberia alone. Even in the great United States, people are dying every day from lifestyle diseases. And the worst thing is that when you don't know what to do.
Wow, the worst thing is when you don't know what to do. So let's begin to close up on this interaction, talking about partnership and sponsorship. Who do you work with? Do you have a team in the U.S. and here on ground, and who sponsors your work?
Right now, we do have a team in the U.S., but everything is funded by us, by my husband. I would say that basically he's our bank. So, but we do have people who volunteer. We do have volunteers who come, and we're hoping that by the grace of God, when our sanitarium is built, that we can get some funding. And also and not only that, but we can also get volunteers from the United States, more medical missionaries who can come. And as a matter of fact, there are medical missionaries who are just waiting for the sanitarium to be built. They're waiting to give their services so that we can be able to come here and help the people. Our sanitarium is, the sanitarium is a place. It's a lifestyle center.
I was about to ask about the sanitarium.
Yes, it's a lifestyle center where we rehabilitate people, and we also help. We do a lot of teaching. We pray with these people, and we let them know that they can do it. They can do it. They can take control of their own lives, and whatever they do with themselves will determine what will happen to them tomorrow. And so we're hoping that by the grace of God, we will have some physical therapists, doctors. We do have some people right now who's waiting to come.
Wow.
As volunteers.
So when is the sanitarium expected to be established in Liberia, and do you need support? If yes, from who? Who are the partners you need to get this sanitarium built?
We need a lot. Right now, my husband and I started this ministry, and it was very challenging. It's a lot of different things that have been happening, and even the place where we tried to do the sanitarium, there was someone who was trying to take the land away from us. That one is another story by itself. But we decided, to go forward with it. So I would say we step out in faith. My husband and I don't have that kind of money to really do what we want to do, but I see the need here in Liberia specifically. I see the need. It is needed here greatly. As a medical missionary in America, I see what it do for people. I've seen people come to sanitariums and no hope. They go to the doctor, especially these cancer patients. And the doctors, after taking chemotherapy and all that stuff, and they tell them, we can't help you anymore. And some of these people go and find their way to a sanitarium, and they change their lifestyle, change their diet and everything, and they end up getting better. So, that tells a lot. And that's why we just, like I said, stepping out in faith,
Stepping out
and
in
we're
faith.
looking out. And I know that by God's grace, we will get partners, we will get people to fund us so that this work can go forward.
Yes, and as a Christian nonprofit ministry, Giving Jesus Global and its partners will certainly keep you in our thoughts and prayers. Any final words before we take leave of you today?
Well, I want to encourage people to join us, okay? We need volunteers here in Liberia. And I want to just let the Liberian people know that, God is there. And anything that you want to do, and that is especially when it comes to your health, if you put your first foot in front, you pray and you trust God that He will help you. He will help you. The crisis that we're having here in Liberia with the stroke and all these things that are happening, we can get past that.
We can get past that. Were the final words of Auntie Lois, as I love to call her, but she's Mrs. Lois Whea Grant, a medical missionary from the U.S., a Liberian-born, of course. She's the Chief Executive Officer of RHUSH, and RHUSH is Restoring Health and Uplifting Souls for Heaven, a faith-based institution founded in 2023 to help underprivileged people and communities by promoting or providing health care and services and humanitarian support to those who are in need. It's been a great time and interaction with this medical missionary, and again, we would like to bring this interview to a close. On behalf of our crew, Pastor Stephen P. Davies and Melchizedek S.P. Dologbay, we want to say thank you for watching and do have yourself a great day. Bye-bye.